Dr. Dan, concerning my scar that stretched from my second linear procedure and how we're going to go in and we're going to fill it in via FUE grafts, can you talk about, in my case, why my scar is stretched? Is it from my working out habits? Is it because of my scalp? What caused that to stretch?
Well, there can be a number of reasons why. A primary reason could be that number one, it was your second surgery. There's a little bit more tension on the suture line. It is by no means, if a patient develops a little bit of a scar from their surgery, it doesn't necessarily mean that the surgeon didn't do a good job. There are some patients that just have very elastic scalps. Now I can tell you by looking at your scar, and I have examined you obviously, it really is not that bad. You've got a little bit of stretch back in your scar, but it is not in any way, shape, or form is an indication in your case that the work wasn't done properly. It can happen to any patient where you can get a little bit of stretching, a little bit of scarring. What we're going to do in your case is just help to camouflage that a little bit by adding some more hair to the scar itself, which then makes it a non-issue altogether. And that's what I tell patients all the time. Yes, I've seen patients that have maybe gone through 3 or 4 or 5 surgeries and they come in and they've got scars everywhere. Well, that's just a result of poor planning and maybe a surgeon that didn't really care. All they want to do is get more good hair and they didn't really care much about the issue of scarring. But that's not what happened with you. You've got a little bit of stretch back. It could be that you were a little bit too active after your procedure. You mentioned how you like to go and lift weights and work out, and that's perfectly fine. But sometimes you have to give that a little bit of a rest for a little longer period of time so that you don't affect any unnecessary stretching in the scar area. But I can also tell you that there's a number of patients that we've worked with over the years, and some patients, it can be a great advantage to have a very elastic scalp because you can safely get a larger number of grafts and you can do a bigger case, and that's great because you can get nice results. But if you have an elastic scalp, that elasticity is always going to be present, and it may lead to a little bit of a widening of that scar over time. But again, it can be corrected, and that's what we're going to do tomorrow.